Hi everyone, welcome to another Facebook Live. My name is Zoe Clark, I'm an osteopath and I've joined the NASS team during the COVID-19 outbreak to help on the helpline and also giving advice to keep you healthy and active during this difficult time. Thanks for joining. As always, the video will remain on the page afterwards and also uploaded onto our website. Feel free to ask any questions as we go along. I'll just make sure that I've got the comments box up so that I can see your questions as they come in. Right, so our topic for today is all about feet and axial SpA, or AS for short. So AS can affect the feet in a number of different ways that I'll be going through, and then I'll go through some ways that you can help look after your feet and help manage any pain or any symptoms that you do get. So some foot conditions not only are more common in AS, but they can happen whether you have AS or not. Generally, I'll go through signs and symptoms that you need to look out for to either see your GP or your rheumatologist. I will be going through some exercises as well, so if you'd like to join in live with the exercises, I recommend wearing loose, comfortable trousers, and you can have socks on or off if you wish to. And if you have a tennis ball or a spiky massage ball like this handy, then it can be helpful to have that handy. I will be going through some massage techniques using a ball. But as I said, the video will remain on the page, so if you don't have these things handy, then you can always come back and watch later and give it a go. So as I said, there are sometimes symptoms that you need to see your GP or another healthcare practitioner for. If you notice that you have any sort of new or severe pain in the foot that doesn't improve with self-care measures, then definitely see your GP for some advice. If your foot becomes red and hot and swollen, again see your GP or out of hours doctor for advice, because sometimes that's a sign of infection or another condition that needs treating much more quickly. And if you find that you keep getting foot problems that I'll go through in this video that can be related to AS and they keep reoccurring, or they're just quite stubborn and won't go away, it's worth consulting with your rheumatologist, because generally the best way to prevent these conditions with AS is to have your actual condition managed and the inflammation under control. So if you keep getting these symptoms coming back, it might be a sign that you need to do something different to help manage the condition itself. So as I said, please feel free to ask any questions as we go along. The video will remain on the page and then afterwards we'll be sharing it on our website with a blog, and we'll also have a write-up of all the exercises with the timings for them, how frequently you should do them, and the repetitions and so on. So don't worry if you can't remember everything all in one go, we'll have it all on the website later on. So firstly, the first condition that I'll be going through is heel enthesitis. So you may have heard that enthesitis is more common in AS. Essentially, this is where muscles that connect onto the bone through a tendon, they can become inflamed, so we call that enthesitis. One of the most common areas for this is in the back of the heel. So where the calf muscles run down the back of the leg, they come into the Achilles tendon and attach on the back of the heel bone. And so if you get inflammation there, we call that heel enthesitis or Achilles enthesitis. If you've had it, then you'll probably remember, because it can be really painful. It can happen on one side or both sides at the same time, and it's quite common that it will come and go and fluctuate quite a lot as well. As I said, if you have these symptoms and you're getting reoccurring enthesitis, then definitely speak to your rheumatologist about it, because it can be related to your AS overall. The most common symptoms are pain in the back of the heel, where I said that the tendon at the back of the heel attaches onto the bone. You can get redness and swelling there locally, and it can be really tender to touch as well. Generally, it will feel okay when it's resting, but then when you get back up to start moving again, it'll be painful. Then with a little bit of movement, it will feel easier, until it gets to a point where too much movement and too much weight-bearing exercise will then aggravate it as well. So there's often a kind of happy medium in the middle that I'll be going through as well in terms of managing the condition. There is lots that you can do to help manage it. So for pain relief, one of the best things is icing it regularly, so that can help numb the area locally. I recommend using either an ice pack or a bag of frozen peas wrapped in a tea towel, and just place it on the back of the heel for 5 to 10 minutes, and it can be really good at just helping calm down the inflammation there and reducing the pain you're experiencing. You can do this every hour if you need to, so you can do it quite frequently to help calm things down quickly. And if you find that it's painful after exercise or after movement, then putting the ice on afterwards can be really helpful for that as well. I'm just going to double check if we've got any comments, because I think sometimes my phone doesn't show them coming up. Let me see. Okay, hopefully I'm not missing any comments, so feel free to let me know if I am. Okay, I think that's worked. Technical issues, right. So, as I said, movement is generally good for heel enthesitis. So keeping the foot moving regularly can be helpful. If you are having to rest it because of the pain or because you've got an issue going on in other parts of the body, then when you're sitting and resting, just doing circular movements with your feet and your ankles can be really good at help reducing the pain and also stopping that inflammation building up, so that when you do get back up and start doing things again, it's not going to be as painful and stiff as well. Also, because of this, when you're keeping still and the inflammation builds up over time, often mornings can be particularly painful when you've got the inflammation going on in the heel. So I'll go through some exercises now that you can do that will help reduce that pain before you then get up and out of bed. It helps loosen things off and helps get the circulation going. So I will change the camera down onto the floor. Just double check. So hopefully you can see there okay. So as I said, one of the best things you can do is when you're still lying in bed, either lying on your back or you can do it sitting up on the side of the bed. It's just gentle ankle circles like so. Come back a little bit. And you can just go clockwise and anti-clockwise about 10 times each way, I would say, just to help loosen things up. Generally, just do it by how it's feeling. If it's feeling really stiff and painful, you don't want to do too much. It's better to do little and often with the exercises rather than do loads all in one go. And again, do on the other side. Obviously, if you're lying on your back, you can do both at the same time. And then to loosen up further up into the foot, you can get the toes moving as well. So you can just sit and scrunch the toes up and then relax. Scrunch and relax. And I'd recommend doing that about 3 to 5 times. And then, as I said, so where you get the inflammation in the Achilles tendon here, it comes down and attaches onto the bone here. So generally this will be the area where you're getting the pain. But these are controlled by the calf muscles up through here. So if you have any tightness in your calf muscle, that's going to put more pressure on this area and make it more painful. So stretching this area, although it can be tender at the time, it can help reduce the pressure on the muscle, therefore reducing the pressure on the tendon and the inflammation in the bone there. And then gradually over time that will help ease it. So doing a stretch into the calf muscle can be really helpful. So you can do this lying on your back, you can do it seated or standing. So I'll stand so that you can see me properly. So what you want to do is with your leg nice and relaxed, you'd want your knee nice and straight as well. You just gently bring your toes up towards you and you should be feeling a stretch through the back of the calf here. You want a nice comfortable stretch, so it shouldn't be painful, it shouldn't be aggravating the back of the heel. And then just relax down. If that doesn't feel strong enough, you can use a dressing gown strap, like so. So you can just place it underneath the toes. I'd go underneath the ball of the foot itself. If you go under the toes, as you pull the strap, you're just going to bend the toes backwards rather than actually bring the foot up. So try and go under the ball of the foot. And then again, you're just bringing the toes up towards you. Use the strap to help to bring it a little bit further, and you might feel the stretch is a bit stronger. And hold for 10 to 20 seconds if you need to, if you want it quite strong, or you can hold it for about 3 to 5 breaths. Then come back down and do the other side. Do be gentle with this as well, because sometimes, particularly first thing in the morning, if you're a bit dehydrated, it can sometimes set off a bit of a calf cramp, which is obviously not a nice start to the day. So just start nice and gently and just don't overdo it. And then the last one, again working on the muscles at the back of the heel there, the tendon, sorry. Just to get things loosened up, you can just do some heel raises. So you're not putting any pressure in there, doing the seated with your feet on the floor, or you can do it lying down as well. If you're lying down, you would just be bringing the toes up and then away from you in like a pumping movement, like the exercises you do if you're in the aeroplane to get your calf muscles pumping and get the circulation going. It's the same kind of theory here. Not only are you getting the movement through the actual muscles and the tendon to help loosen the area, you're getting that circulation going after being lying down and still for a little while when the inflammation might have built up a bit at the back of the heel, aggravating that pain there. Great, so how's everyone getting on with those? Hopefully they're all comfortable if you are joining in. As I said, if you just want to join in, if you want to come back to it later on and do it separately, then you're welcome to. Let me just see. I still can't see any comments, I'm afraid, so I do apologise if you are commenting and I'm not replying, but I will come back and reply to them afterwards. So yeah, I'll come back afterwards, I'm afraid. I have put my email address up in the description of the video as well, so if you'd like to speak to me directly for any personalised advice at any point, then just send me an email, zoe@nass.co.uk. So for the heel enthesitis, if those exercises don't help, and if using the ice regularly doesn't help, give it a week or so, and then you can always consult with either your GP or a podiatrist would be helpful, because they're specialists in feet. Physios, osteopaths and chiropractors should all be trained to help with this as well. Sometimes it can be helpful to use a little bit of foam in the heel of the shoe to help lift the heel up slightly, because that relaxes the calf muscles a little bit, takes the pressure off where that tendon attaches onto the bone, and it can just help let that area recover so that you can be a bit more active with it without aggravating it. Generally this would be a short-term use, but we wouldn't recommend it long-term, because that can end up tightening the calf muscles more. But sometimes it can speed up that recovery. So if you are having problems with this, then just get in touch with a podiatrist or another manual therapist for help with that. So the next condition I'll be going through is plantar fasciitis. Again, if you've had this condition, then you'll definitely remember, because again it can be really, really painful and it can really restrict your movement. With all foot problems, if they're restricting your movement and you're not able to be as active, that's going to have a big knock-on effect then onto your AS, because obviously the best thing for AS is movement and activity, so that can be really difficult. So the healthier and happier our feet are, the better. So plantar fasciitis in particular, people often notice pain first thing in the morning when they're weight bearing. This is because, again, it's an inflammatory condition. So if this is the sole of your foot here, and here is the heel and my fingertips are the toes, the plantar fascia is a band of connective tissue that runs along the sole of the foot. So it helps support the foot and support the arch there. It's a really important structure. But it can become inflamed and painful, and you can get pain all the way along the sole of the foot with this condition. So the best thing, again, is movement, and also using ice locally to help reduce the pain there as well. One of the biggest things you can also do is massage, so I'll be going through some massage techniques using a ball, so if you've got one, then get that handy if you'd like to join in live. For ice for the plantar fascia, because sometimes it can be difficult to get the foot in a position where you're getting the ice all the way on the foot, unless you've got a lowered arch, you can generally get right into the arch then. Using either a can from the fridge or using a water bottle almost full and then stuck in the freezer until it's frozen solid, you can use that on the floor almost like a rolling pin. So I'd place it on the floor, and sitting down, because you're not putting too much pressure through the foot, just place the heel of the foot on the can or the bottle, and then you'd roll your foot over the bottle to get the ice onto the sole of the foot. Do this wearing socks, because you want to protect the skin from the cold, because you don't want to get any ice burns. But just using the ice along the sole of the foot and some very gentle massage into the foot can be really helpful. It helps reduce that pain and reduce the inflammation as well. So for massage into the area, again, I'll bring the camera down. So the spiky massage ball can be really helpful. So if you've got one of these, that can be great. You can get them really cheaply on Amazon. I'll drop a link in the comments of one of the brands, but there are so many brands out there and they're really reasonable. But you can use a tennis ball as well. With this, I'd recommend doing it seated so you don't put too much pressure down, because it can be quite tender and it can also be quite ticklish as well. So just do a little bit of pressure to begin with. I'm doing it standing just so you can see me. There we go. So just gently place the ball of the foot on top of the ball. Apply a little bit of downward pressure and then just roll the foot forwards and backwards. So you're getting a little bit of a massage into the sole of the foot there. So you can hear the ball creaking on my yoga mat there. And then you can also get into the outer edge of the foot, so turning your foot slightly, just roll onto the outer edge. And then you can also go onto the inner arch of the foot by turning your foot the other way if that's comfortable. So the pressure should be strong enough so that you can feel that downward pressure and that massage into the sole of the foot, but it shouldn't be to the point of discomfort or pain. If it's painful, then just release the pressure a little bit or do it for less time. Okay, so the calf stretch that I showed you for the heel enthesitis can be really helpful for this as well, and just gentle movement too. To get a stronger stretch right into the plantar fascia rather than into the calf muscles, you can do this with stretching your toes. If you've got arthritis in your toes, particularly your big toe, that restricts the movement coming back, then don't do this. Similarly, if you've got gout and you tend to get episodes of gout in the big toe, or if you've had bunion surgery or anything where you've got pins in the toes, I wouldn't recommend this because it can be too strong. But if you don't have any problems restricting the movement of your toes coming back, this can be great at stretching into the sole of the foot and into the plantar fascia there. So you can do it sitting down as I'm doing here and reaching down. If that's difficult, you can bring the foot up onto your knee and then do it from here, whichever way is most comfortable for you. Or if you have mobility problems, and you can always ask someone to do it for you, but obviously communicating so they're not doing too much of a stretch. So you just gently want to just grip onto the toes there, right near the base of the toes where they attach onto the ball of the foot. And then you just gently bring the toes back towards you as far as comfortable, and then relax down. So generally you'll feel a stretch along the sole of the foot in here. And again, so I'll show you from side on, so you'll bring the toes up like so. It doesn't matter how far you get, really concentrate. Sorry, a lorry going past. Doesn't matter how far you bring the toes up, you concentrate on what you're feeling in the ball of the foot here, because everyone has different mobility. So with this, you're not trying to get them as far back as possible. You're trying to get them far enough to get the stretch in the sole of the foot, but not so much that it's painful. With that, I'd recommend holding about 10 to 20 seconds so you get a good stretch through there, and you can do it a couple of times on each side as well. So I'll bring this back up again. I hope everyone is getting on well so far. I'm going to give it another go on trying to find any comments, because I imagine there are people just popping in at least to say hi. So let's see. I do need to get this text sorted. Nothing at the moment. Okay, I will come back to the questions in the comments afterwards, and as I said, drop me an email if you'd like any specific advice. Hopefully I'll cover all the questions in the video anyway. So the other thing that can be really helpful both for heel enthesitis and for plantar fasciitis is really good footwear. So you want something that's nice and supportive with a good thick sole that gives it a lot of cushioning. Also, using lace-up shoes like trainers are particularly helpful, because if you have slip-on shoes, as you're walking and the foot is in a slipping movement with the heel coming out of the shoe, you're going to be using your toes and the muscles all in the feet to help kind of grip and keep the shoe on. Whereas if it's laced up and it's secure, then you're not going to have that pressure on the muscles in the area. Generally, if you don't have any foot problems, there's absolutely nothing wrong with having slip-on shoes, but it's just if you've got pain in the area and you're trying to reduce the strain in the area, it can be helpful to stick with supportive lace-up shoes like trainers as things are recovering. If you work in a job where you're standing a lot of the time and you don't have many breaks to rest, then using a cushioned mat can be really helpful. So I treated a lady who's a chef, and she put down like a silicone mat in the area where she's generally working, and that helped a lot because it just reduces the pressure, particularly because she was just otherwise working onto a concrete floor, which no matter how good your shoes are and no matter how many breaks you take, sometimes when you've got heel pain or plantar fascia pain, it's just going to aggravate it. So using like a silicone mat long term can be really helpful. The last condition that I'll go through is toe clawing. So this is really common in AS when you have any postural changes that mean that your body is leaning forward, because your centre of gravity then comes forward, and in response to this your body claws your toes up to try and give that grip and try and give that centre of balance to stop you leaning forward quite so much. So if you imagine this is the foot, toe clawing is when the toes claw up like so, and you get shortening in the muscles and the tendons in the base of the toes here. It can be painful for some people, but it depends on how things have adapted. One of the biggest things we want to do, obviously, other than actually managing AS, so you've not got that forward posture causing the clawing in the first place, the best thing we can do is help to stretch out the toes, and just doing the gentle massage that I was showing, and also that toe stretch of bringing the toes back can be really helpful for that as well. Again, as well, for pain, using ice locally can be really helpful for this, and just getting things moving as well. So toe scrunching exercise can be really helpful. I'll show you that down here. Oops. So again, generally seated or lying down, and you just have your feet nice and relaxed, and then just scrunch your toes up and relax. And so just helping get the movement. And as I said, for toe clawing as well, you can do that gentle stretch, so you'll bring the toes back a bit as well. And same on the other side. And then you can use either the spiky massage ball to help massage into the area and go right up onto the tip of the toes. Or you can even use your hands, so you can just do gentle movements. So you grip the toe itself and then you just pull and just do gentle circular movements. So if I go side on, you'll see that I grip the toe and then I'm pulling in this sort of direction to create a little bit of a stretch, and then just doing a gentle movement through there. And then again, you can move on to the next one, again pulling away from you and gentle movement. And if you're able to reach down into the feet as well, you can do just gentle massage into the sole of the foot. So you can just turn the foot outwards like so. If you can bring the foot up onto your knee, that can be good, and then you can reach with both hands. But generally, just using your thumb in nice circular movements, you can massage into the sole of the foot and feel all the little bones in there as well. The foot's wonderfully complicated, very clever. But yeah, just do little circular movements with your fingertips. You can do both hands at the same time or one at a time, and all the way up into the heel as well. You can even just give the foot a little bit of a wiggle, so relaxing your toes and gripping them, and just move like so. And then a really nice one to get, so in the foot you've got these long bones through the middle part of the foot here, and you can actually grip on one part of the foot there and then grip just about a centimetre over, and then just do a little bit of a wiggle. So as you're lifting one hand up, you're then dropping the other hand down, so you're doing this kind of movement, holding onto the foot, just giving the bones a little wiggle, loosening it all up. It's like being back in clinic for me, because obviously at the moment I'm not doing any face-to-face appointments, so I can treat my own feet at least. And give it a go on the other side if you're trying live. So again, just gripping onto the one bone and then gripping about a centimetre over, and then just giving it a wiggle up and down. You may not get as much movement through here. It depends on your general mobility. Personally, I'm hypermobile, which means that my joints move a little bit more. So if you don't move this much, then obviously don't worry. Right, so in terms of a morning routine, I have put together some instructions that we'll put onto the website. So it's a written page of exercises that you can do in the morning to help your feet loosen up and keep things comfortable. It includes all the exercises we've just gone through as well, and all the advice we put into a blog post on the website too. So keep an eye out for that on the My AS, My Life page on the website. So I hope that has been helpful, and I hope that's covered things. As I said, if you do find that you've got severe foot pain, or if you've got any redness, heat or swelling in the foot, then see your GP or out of hours doctor to get things checked out. Make sure it doesn't need any other course of treatment. And if you do have a bit of a stubborn foot problem, if these problems keep reoccurring, then speak to your rheumatologist and make sure that your AS is well controlled to actually prevent these problems occurring in the first place. If you find that your AS is as controlled as possible, but you're still getting problems, then consulting with a podiatrist, physio, osteopath or chiropractor, and they'll be able to give you some specialised advice as well. So again, I hope this has been helpful, and I'm afraid I can't see the comments, but I'll drop in and I will answer them after the video. Feel free to drop me an email, zoe@nass.co.uk. I'll be coming on live again next week. We'll pop the event on the Facebook page when it's all been finalised, but I'm going to be talking all about flares and how you can help manage them, and going through a bit of a creative, sort of crafty project, creating a flare book, so that when you are flaring, you've got something to look at, both to give you ideas to help manage the pain, but also something positive to look at as well. So if you'd like to do any crafting, if that's your sort of happy thing to do, then you may want to join in for that. So again, thank you for joining. I'll check out the comments and answer any questions, and hopefully see you next week. Keep well, everyone.